My name is Dr. Eric Rudnick, and I will be narrating the HAVBED and MCI event training with EMResource. This is put on with HPP funds. This is Northern California EMS Agency, also known as Nor-Cal EMS. So the objectives. We will hopefully demonstrate the importance of EMResource in being able to respond to events, queries, and polls. We'll demonstrate how to have a HAVBED event in EMResource, demonstrate responding to an MCI or multiple casualty incident event in EMResource. It is highly recommended that new users of this software attend one of the free training seminars offered by Intermedics. That's the company that has developed EMResource. It cannot be stressed enough that the federal government mandates that all states utilize HAVBED, and this is part of the disaster and emergency preparedness efforts. The response to queries, polls trickles down from the federal to the state to the regional, and then finally to the local areas, and the local level. So HAVBED resource polling, the U.S. Department of Health and Human Services, or HHS, will need to know where patients can be safely and effectively transported during large-scale events or disasters. Examples are Hurricane Katrina, the 2008 wildland fires in California, which were devastating to many parts of the state, and patients had to be evacuated from nursing homes, acute care hospitals, and were distributed all across Northern California. The key portion of this type of web-based process is that is in real time. We're able to these patients will be able to receive care during an emergency, and we need to know where they need to go. It is critical that this is real time, and that when these polls come out, that the individual healthcare facilities respond in a timely fashion. This system is of vital importance for the California local operational area being the local county and its political subdivisions, and for the Office of Emergency Services. Typically, in many counties, that is the sheriff's office, and at its state level, it is its own standalone department. Nor-Cal and Nor-Cal EMS counties, consisting of Glenn, Trinity, Lassen, Modoc, Plumas, and Sierra counties, are located in Region 3, which is the California Mutual Aid region. There are 6 within the state of California. Again, the essential part of HAVBED and EMResource is that it allows real-time information to be shared, that there is no delay, and that it really does help coordinating these efforts between the local EMS agency, the regional disaster medical health specialist, RDMHS. Without EMResource, it would not be possible to do this type of patient demographic distribution. This allows the, quote, raw data, which is the individual healthcare facilities status and how many patients they can have and what type of patients, so med-surg, ICU, etc., and convert it into what's known as usable intelligence. The raw data, unless it was rolled up, which does happen in EMResource, would not be usable. So these tools are incredibly valuable during any sort of large disaster or large-scale event. These can be used for any type of event. Traditionally, it's an MCI or multiple casualty incident. Many times, however, in a pandemic, when alternate care sites are erected to help offload hospitals and potentially crisis guidelines are being used in EMS, it will be invaluable to have this type of process going on. The other thing that needs to be thought about is an MCI event in Modoc County versus an MCI event in Los Angeles is very, very different. In Los Angeles, an MCI event of 25 patients probably doesn't even register on the scale at all for them. It can be easily handled with existing resources. Where in Modoc County, a 10-patient MCI from a multiple vehicle collision would overwhelm local resources, and they would have to reach out to past probably the normal day-to-day mutual aid and bring in regional resources, such as maybe a ambulance strike team. It's all about the available resources and what's available in your neighboring operational areas or counties, what's available from the region. HAVBED Overview. A HAVBED poll, again, is web-based for evaluating bed availability. All these beds are typed, so we know exactly what type of bed and what resources are available in the small rural hospital, for example, Banner Lassen Hospital versus Mercy Medical Center in Shasta County. This is updated daily. It's part of a routine, and in a surge event, the capacity of that healthcare facility is done emergently. These resources, again, are predefined by the federal government, and so they should not be changed. The status can be evaluated for the local operational area, your county, and all political subdivisions. At the regional level, again, we are in Region 3 in Nor-Cal EMS, and there are 6 total. It goes up to the state, and then eventually to the federal level. This guide addresses the HAVBED event utilized for surge events in both local and regional capacities. So, mass casualty or multiple casualty incident overview. The control facility, these are usually trauma centers and large institutions. They will be performing the polling for the bed availability, so the local independent facilities will not do a HAVBED poll. This is really, in our region, the control facilities, and this is spelled out in the multiple casualty incident plan. So the ability of a control facility to have immediate access to vital information during a multiple casualty event can't be overstated. For example, when the Orland bus crash took place, HAVBED polls went out, and so we knew within our region and in Region 4, which is adjoining Region 3, how many beds and what type of beds were immediately available. This was real-time information shared between the control facility in a county or region. In this case, it was Butte County, and the surrounding hospitals and trauma centers were a dispersal of all these patients, because you just can't bring all the patients to one facility, because all you're doing is bringing the, quote, disaster, unquote, from one location to the hospital if all these patients ended up there. Again, this allows raw data to be converted into usable intelligence. So, the hospitals and our trauma centers can immediately advise the control facility how many and what type of patients they currently have the ability to evaluate, treat, stabilize, and or admit. Are these immediate, delayed, or minor? Now, it's important to note that many of the counties in Nor-Cal EMS are very rural, and all the hospitals are critical access hospitals, meaning they have 25 beds or less. So none of these hospitals have an intensive care unit, and so those values would be 0. And so when it's rolled up, it's not expected that a hospital who doesn't have that type of resource or that capacity would suddenly, during an event, whether it's a disaster or multiple casualty event or incident, suddenly be able to take intensive care patients. It's just not feasible nor feasible. The hospitals, again, are within the operational area, mutual aid region, state, and potentially interstate or even nationally should the need arise. This is what happened back in Hurricane Katrina, where patients were distributed over multiple different states because the infrastructure of the healthcare facilities in Louisiana, in particular New Orleans, was devastated. So this guide is going to address the queries and polls that can be used for any type of surge event. So the purpose of queries. Again, every healthcare facility has different resources of equipment, space, personnel, and expertise. These queries ask for the, quote, predefined typed resources I mentioned earlier. The resources available for patient distribution dynamically change. This happens in real time, and as the event unfolds, less and less resources usually are needed. Healthcare facilities may be receiving patients from a local incident or potentially even from across the nation. The key to these responses is a rapid response. So disaster managers can actually make decisions on where to send patients. So I can't stress enough that everybody who works at your facility on every shift, day or night, 365, needs to be able to respond to a HAVBED query. The people who are conducting these polls, again, are under huge pressure to find places to send these people, either directly from the field or from other hospitals who got many patients and are now trying to send them to other facilities to offload this huge surge that they may have gotten initially. And this would be accomplished by interfacility transports. So, again, the purpose of HAVBED and MCI events in EMResource. You could not physically poll all facilities in a region rapidly enough to get accurate data without this web-based system. As it says here, the fax is dead, long live the web. The time required to contact each individual hospital would just be overwhelming. As I said earlier, there needs to be staff trained and familiar with the system 24/7, 365, on duty. Not on call, not available by phone, but they need to be able to do that at the facility. So again, this is web-based software. The queries go out rapidly and efficiently to huge numbers of hospitals, clinics, and alternative care sites, if need be. The bed type, again, is standardized and gives a really clear picture of what that healthcare facility is capable of. The software automatically summarizes the data as it works its way up the pyramid, from the local to the regional to the state and potentially federal. So, there's a standalone module for the ability to respond to HAVBED and MCI and EMResource. This module will move pretty quickly to train you, both the medical and health personnel, what needs to happen from a healthcare facility standpoint. There's also just-in-time training, which is much more succinct. If just in case there's new staff on who really doesn't know or haven't been trained yet. Again, this is a focused, brief overview of the California medical and health disaster response and the National Disaster Medical System, part of the U.S. Health and Human Services Administration. So we'll go briefly through this. The NDMS, National Disaster Medical Health System. Again, this is a section within the U.S. Department of Homeland Security, or DHS. They work with FEMA, or the Federal Emergency Management Agency, handling various different types of disasters, whether it's natural, such as an earthquake, flood, technological disasters, cyber attacks, major transportation accidents, such as what happened in San Francisco when the Asiana airplane crashed, and acts of terrorism, including weapons of mass destruction. You don't need to think too hard to go back to Timothy McVeigh in Oklahoma to see how important this type of system would be. So there are three primary goals in the NDMS. First, to provide health, medical, and related social service response to a disaster. This is in the form of medical response units. In California, it's CalMat teams. Federally, it's DMAT teams. California does have DMAT teams, but traditionally, if you have a DMAT team within your state, they are already preoccupied doing their, quote, normal day job. So these federal resources would come in from outside of our state. You try to evacuate patients who cannot be treated and cared for in the affected area. For example, if there was a dam failure in Shasta County and a huge amount of the infrastructure, medical infrastructure, was damaged and inoperable, these patients would go elsewhere within Northern California and potentially the whole state. So, going a little bit more into the NDMS, we just mentioned just a moment ago about the DMAT teams, the Disaster Medical Assistant teams. They have similar pediatric teams, burn teams. Nobody likes to think about this, but they have disaster mortuary teams. These teams were working for many, many months after 9/11. We have urban search and rescue, which were of incredible importance in Louisiana after Katrina. They have mental health. There are vet teams, the VMATs. They're all part of this medical response. So let's go through some definitions. EOC, Emergency Operations Center. Well, that could be the operational area EOC, so at the county level, or cities have EOCs. So you can have multiple EOCs in an operational area. DOC, a Department Operations Center. Traditionally, departments like public health have DOCs, not EOCs. As an operational area, again, is a county and all its political subdivisions contained within. So, Plumas County is an operational area. The city of Quincy is contained within the operational area, and both can have their own EOC up and running during different types of disasters. Region, we've talked about this already. Region 3, which is where Nor-Cal is one of 6 mutual aid regions as defined by the Office of Emergency Services. So, MOHAWK, or the Medical Health Operational Area Coordinator, serve a vital role at the county level, being able to plan. These are primarily planning positions, except when there is an event, and they can be activated to help coordinate resources. If you look in California Health and Safety Code, there are 17 different functions. Many times this is the local health officer or their designee, and the LEMSA administrator or local EMS agency administrator can be the MOHAWK. RDMHS, RDMHC, Regional Disaster Medical Health Coordinator or Specialist. It's a regional position to help coordinate the response to events within the operational areas. For Region 3, there are 13 operational areas, 13 counties. So the RDMHS and RDMHC assist in pre-planning for disasters and emergencies. So here is a map of the overview. If you look at the very top, you can see Region 3. Just below that is Region 4. The coastal region is huge. Geographically, it spans over 800 miles. It goes from Humboldt all the way down the coast. So, Standardized Emergency Management System, or SEMS. This is what NIMS was initially based upon. So, you have the field response. So, you have the incident commander, local city response, again, within the operational area. Operational area is the county, it's all its political subdivisions. The regional level that we talked about, this is where the RDMHS and RDMHC function very well. You go to the state level, you have EMSA, the Emergency Medical Services Authority, and CDPH, California Department of Public Health, working in collaboration with other emergency management organizations such as OES or the Office of Emergency Services. And then you go to the federal level. So as you can see, it starts locally in the field and works its way up the chain of command at the federal level. And this is how resources are ordered. So it goes up the chain, And then when you get responses back from the federal level, the feds don't communicate directly with the field. That would make no sense. So, requests of resources and staff go up the chain, and then they work their way down. So the feds talk to the state. At the state level, they talk to the regions. Regionally, they talk to the operational area, most times the Mohawk. Then it goes to the local city if needed, and then to the field. So, EMResource administrator, the facility, control facility, hospital, public health department, the individual responsible for initiating these events. So public health can, or the control facility. HAVBED, the National Hospital Available Beds for Emergencies and Disaster System. This was initially asked for by a research study developed by the Department of HHS, U.S. Department of HHS. Again, a multiple casualty incident, the precise definition really varies from what the absolute number of casualties from an operational area to operational area. We talked about this earlier, that what an MCI is in Modoc County, or for example, even Sierra County that doesn't even have an acute care hospital compared to Los Angeles would be very different. The bottom line is that the demand exceeds the available resources, and that's the key to this. So let's talk about some more definitions. California Department of Public Health, or CDPH duty officer. This is a point of contact, 24/7, 365. They can mobilize many different resources, notify Office of Emergency Services, open up the departmental EOC. This is at state level, starting the process to open up the state's Emergency Operations Center. The Emergency Medical Services Authority, again, also has a duty officer available 24/7, 365. They can mobilize resources such as ambulance strike teams if needed. This can also occur at the regional level with the RDMHS and RDMHC. And they can also open the state's EOC, or Emergency Operations Center. So, the key for HAVBED is its usability. There is no one categorization method that fits all hospitals, but this is the best fit that people have come up with. Again, confidentiality is strictly enforced based upon permissions granted. So one hospital does not know what the other hospital is saying they can take. So there's no, quote, gaming of the system. And the views change as you head up the chain of command with different permissions. As we said earlier, if the hospital does not have a certain category of bed or capability, such as ICU in a critical access hospital, you leave the cell blank. You don't change categories, you don't add or delete, or the way that they ordered formatting. This is specific data and would disrupt the normal flow in the software. A zero bed count, again, will be entered as a, quote, zero. LEMSAs, who are also responsible for submitting HAVBED data to California Department of Public Health, or CDPH, and EMSA, this has to happen within 2 hours of notification. Again, this has to be real time because there are people trying to make critical decisions on where to send hurt and injured patients. HAVBED definitions. So available bed, vacant, immediately ready for patients. Of importance is that this also includes the support space, equipment, ancillary support services such as respiratory therapists, phlebotomists, staff to operate under normal circumstances, and that also includes nursing staff. These are licensed and physically available with staff on hand to attend to the patient once they occupy the bed. Staff beds, licensed and physically available with staff on hand, again on hand to attend to the patient. This includes both occupied and available beds. Staff beds equal available and occupied. Staff beds should never be less than available beds. Again, more HAVBED definitions. Adult intensive care unit. Beds that can support the critically ill or injured patients, including ventilatory support. So many of our critical access hospitals in the Nor-Cal region do not have traditional ventilators for critical patients. Many times they just have transport ventilators because they don't have the resources to care for these patients, so they rapidly transport it out. Medical surge beds, these were once thought of ward beds, old terminology. Burn, these are really burn ICU. These either need to be approved by the American Burn Association. Many times the local EMS agency will designate these. These, interestingly enough, are not to be included in other ICU bed count. Peds ICU, as for adults, but this is 17 years of age and younger. I know that many of us define a pediatric patient as 15, but on the national level it's 17. Again, pediatric ward beds, medical surge beds, these again are for patients 17 years of age and less. Psychiatric, that's a rare commodity nationwide. These beds are in a closed, locked psychiatric unit or ward where patients will be attended by a sitter. They're in a safe environment where they cannot harm themselves. Airborne infection isolation. These are negative pressure rooms, isolation beds. These beds provide negative airflow, so everything gets pushed out. This may be represented as beds available in other types. For example, many times ICUs have negative isolation rooms, or some hospitals actually have negative isolation ward rooms. Operating room, pretty standard. It's equipped, staffed, and could be made available for patient care in a short time. Of note is that there is no definition of what a short time is. Is that a half an hour, an hour? It's just not defined. Emergency department status, there are 3. They're open, so they're accepting patients by ambulance. They're closed, they're not accepting patients by ambulance. And NA, not applicable. This hospital doesn't have an emergency department, such as a rehab hospital. Decontamination, 2 statuses available. They have available, the institution has chemical, biologic, radiologic, multiple patient decontamination capability. This doesn't necessarily have to be a fixed structure, but rapidly erectable and put into place. Not available. Institution cannot provide this service. However, if they're Joint Commission accredited, then that is part of the Joint Commission accreditation process that they have the decon capability. Ventilators available. As I mentioned earlier, many small rural hospitals don't have that. This is the number of ventilators that are present in the institution. Key here is not being used and can be supported by the currently available staff. So, here's the login page for EMResource EM system. So, logging onto EMResource. You go to the web address URL of EMResource and you should see the prior screen. When you first arrive to the website, your browser is automatically redirected to one of the, quote, active servers. This is reflected in the URL by inserting a number after the www. If you plan on creating a bookmark, key here is that you redirect it to the base system and not one of the redundant server sites. Pretty self-explanatory. You enter your specific username, enter your specific secure password, and then you click on the login button and your personalized default page opens. Remember that the username and password are case sensitive. Navigating the site. Once you're logged in, the default page or the starting point will be entitled California Inland Region, and below the menu bar is the California Region 3. That's the region that the Nor-Cal EMS counties are in. This is the default page. This will show you the information on the individual hospital statuses. Trauma center statuses, EMResource shows EMS air resources, the systems that are operating for information, and recently we've added the EMS ground view. Please note that not all items listed in this presentation may appear on your screen, depending on what type of permissions you have. Some items are limited to those with only administrative privileges. If you hover the cursor over any tab, other regions, preferences, regional information, you'll get the drop-down menus. So, pop-ups. After logging into the system, a pop-up window may appear. This may be a system-wide announcement. Examples would be multiple casualty incident alert. You click on acknowledge all notifications to close the box and navigate to the intended page. View tab. This allows the users to see the live, key here, live status of the various hospitals, trauma center, EMS air resources, EMS ground resources, and other resources available. You simply click on the desired resource name. The user can receive up-to-date information on the selected resource. So, here's a demonstration of the California inland region. This is a demo. The top there shows Butte County. Inlow Medical Center is open. Feather River here is open. However, they have no neurology nor vascular surgeon. Oroville Hospital is open. Lassen County, Banner Lassen Hospital, shows that it's open, but its CT scanner is down until tomorrow. Of note is that Banner Lassen just became a level 4 trauma center. Plumas County shows the 3 hospitals, that they're all open, and that Seneca is a level 4 trauma center. So let's go to the next page. This shows all the air resources that are available. The air providers are very good about keeping this up to date. And as you can see, except for Mercy Air in this particular screen in Modesto, all the other air resources are available with contact information. So here's what we talk about the pop-up. This was a drill to test MCI for learning purposes. I created this one, and you would just go in and click acknowledge all notifications. So here was a real event. It shows Butte Control, which is Enlow. This is our control facility. This was an event on Highway 99 West and Rodeo Avenue. You see update 2, update 1, and this at the bottom is when it was started. So chronologically, this was an MCI pickup versus school bus, never a good thing. Confirmed 4 patients, unknown ages or level of triage. 2 ground ambulances and 1 flight crew were dispatched. That's the initial. And then the second update, MCI completed, all patients distributed. Key here is distributed. MCI pickup truck versus school bus, 3 confirmed patients. 1 immediate went to Enlow Medical Center. The other 2 minor ones went to St. Elizabeth's in Red Bluff. View tab, your default view. The View tab allows the users to see the live tracking of the various hospitals, trauma centers, EMS air resources, EMS ground resources, and others. Again, you click on the resource, and the user can receive the up-to-date information on the selected resource. Most views contain the resource name, the resource status, and any other comments associated with the current status and when the resource was last updated. So this will be the explanation for slide 33 when we go through it. This is going to be a demo mode. You're looking at Glenn County. The key signifies that you have the appropriate rights to update the status. Glenn Medical Center, Level 4 Trauma Center, signifies that the hospital is a Level 4 trauma center. There's only 1 acute care healthcare facility in Glenn County. R3 facility is open, that stands for Region 3. It's green, open for patients. There are no comments as opposed to the Banner Lassen one, who had their CT scanner down till tomorrow. The last update shows the last time the facility updated its status. Ideally, this needs to be done at a minimum every 24 hours. So, when you look at the default view, and that was on slide 34, you looked at Feather River Hospital. The key signifies that you have the appropriate rights to update the status. Again, Region 3 facility is open. This is green. Feather River Hospital is open. but as noted, they had no ENT and no neurology. The last update shows, again, the last time the facility updated its status. Again, it needs to be done at a minimum every 24 hours. In this particular screen, Banner Lassen and Surprise Valley hospitals had not updated. Shame on them. Explanation for the default view for slide 35. This demonstrates the EMS air resources in the default view as we saw. All the aircraft were either green or red, and there's only one, that Mercy Air in Modesto, that was not available. Comments can state various different things, such as phone numbers for contact, and update shows when this was last updated. And for an air provider, this is probably going to change multiple times throughout the course of a day. We talked about the pop-up box, and this is to satisfy, click on the acknowledge all notifications, and then we showed you the drill that showed sorry, this was not a drill, but the MCI between a bus and a pickup, view control, which is Enlow, at Highway 99 and Rodeo Avenue. So let's look at this slide here. This is Glenn Medical Center. This is the base characteristics. It shows you a nice map of the area. Pretty self-explanatory. Again, it showed the detail for Glenn Medical Center, a level 4 trauma center. The resources can be edited here. It shows a map of the local area, contact information, and contact personnel. Here's another view of the Glenn Medical Center. It shows at the bottom who the administrator is. Currently, that's Patty Lima, our regional administrator at Nor-Cal. The other person who can do it is Region 3 Duty Officer, that's SSV. And at the facility, that's Tracy Torres for Glenn Medical Center, the contacts. Pretty self-explanatory stuff. I don't need to reread this to you. So here we go, other regions. So if you have the right permissions, you can see Monterey, San Benito, and Santa Cruz counties, Santa Clara County, San Mateo, Coastal Valleys EMS, Nevada, and Solano counties. So there's lots of other available information. Pretty self-explanatory. The thing that you need to realize are the colors on other counties may not hold the same meaning or census as your current county or region. So that changes a little bit. This was slide 47, the one just prior to this. Here's a very useful tool, the IM or Instant Messenger. EM system enables clients to instantly interact with other systems via the instant messaging function within the navigation toolbar. This is all confidential. This function can instantly send messages from one computer to another. This is another way of redundant communication. So, Instant Messenger continued. You can conference with multiple users or have a single private communication. This is very important. You can talk to the emergency department at the same time that you're talking to the control facility. EOC and DOC can talk. Hospitals can talk, and the alternative care sites all at the same time. It's secure, immediate, and it is very user-friendly. So let's talk about potential applications for the instant messaging. It's HIPAA compliant. So, patient's face. EMS obtains the patient name, triage tag with the tracking number. Okay? It says heads. 2, a digital image is obtained with a handheld device or tablet. The ambulance is a local area network. This goes to the disaster, which is an old term. It really should be a control facility now. And this helps track and identify patients amongst the different facilities. So, recognition of an MCI. You alert and activate. You contact the regional control facility. It's better to alert and be wrong and cancel it than to play catch up. The field transportation group supervisor will be talking to the emergency department at your potentially a second trauma center. Here's another receiving facility. Here's an alternative care site. So there's interaction between the control facility and the field transportation group SUP. This helps with the patient dispersal, because the regional control facility knows what the bed availability is from the other places, such as the first ED, the second ED, which is the trauma center, and the alternative care site. So here you go. You can see how the regional control facility is the central hub in a hub and spoke system. The field groups, once they know from the control facility, they can start redirecting patients either to the alternative care site or to the trauma center at Center 2. The immediate would go to the trauma center. Delay could go to the first emergency department, and then using a bus or other alternative transportation means, all the minors could go to the alternative care site. So you can see how this web really works very well. And then again, patients that end up at the alternative care site who really are more than minor then are re-triaged to the trauma center. And these delayed patients are safely transferred by traditional EMS. So this would be a brief overview of how a multiple casualty event would happen. So here's what it would look like in EMResource, California Inland Region. This is a drill, a test for an MCI. Here's the icon, which is a little flaming folder. Status, this would be ongoing. This is when it started. This drill started on the 18th of May 2014 at 8:32 in the morning. It ended the May 19th, 2014 at 8:35. Title of this MCI was Test. This was a drill, yes, and the template was the Region 3. And here over information, only a test for learning purposes. So as you can see on slide 53, it was pretty self-explanatory. That's the MCI piece. This showed the MCI drill page, and this is what the control facility would see, and that the control facility and or public health can send out these alerts. Here's another drill. Here, Feather River, they have no neurology again, no vascular surgeon. Orchard Hospital, which is a level 4 trauma center, they have no neurology, pediatrics, cardiology, or vascular surgery. Here, the hospitals that were being polled, though, with the flaming folder were Gland Medical Center and Modoc Medical Center. So, the MCI colored banner scrolls atop the screen. The flaming yellow envelope represents the MCI event. Not all facilities will have the ability to create an MCI event. That's only going to be the control facility, and sending out the query is the responsibility of the control facility. So here's another test. This was started again by me on the 18th at 8:32, only a test. And you can see that the hospital is updated, and they evidently didn't have any availability. Don't need to read the slide. It really just goes over what I just explained. So this default view for the explanation of the slide continued. There were only 3 hospitals being queried. Next to each hospital is the categories of immediate, delayed, and minor, which are the traditional start triage categories. The hospital's ability to provide decontamination where their surgeon is available was also shown. So here's Glen Medical Center again. This shows R3, Region 3 facility status. It's open, and they have not updated yet. Really just shows the specific data fields for the hospital. So, definition immediate. Number of patients classified as immediate that the facility can currently accept. Pretty self-explanatory. Glen Medical Center, level 4 immediate. They said that they could not take any critical patients at this point. So here is Enloe Disaster Control Facility, MCI, Orland I-5. This is from the Orland bus crash. Update information, total victims, 1 immediate to the burn center, 5 delayed, 4 minor to Enloe Medical Center, 2 delayed to St. Elizabeth's, 2 delayed to Shasta Regional, 1 delayed and 2 minor to Oroville Medical Center, 1 minor to Glenn Medical Center, and 22 minor taken to Orland Memorial Hall. Unconfirmed up to 9 fatalities, and this was updated by the Enloe charge nurse. That's update number 5. You can see that this changes update 6, 7, 8, and 9. I won't read each of the updates to you. Here you can see in a little greater detail what they would look like. So slides 62 and 63, we just went over them, and it really shows Glenn Medical Center, and then it shows the bus accident. Self-explanatory, we already went over these. California Inland Region demo. So we have drill, another test, and here we have HAVBED drill, another test. So we have 2 different events going on, the red and the purple. So here at Glenn Medical Center, we have the flaming yellow envelope and an MCI drill. This shows the bed, and here's the flaming envelope and the bed. So the first 2 demonstrates there are 2 separate events occurring. The first is a red MCI banner on the left screen. The second is a purple HAVBED drill demonstrated by the bed icon. HAVBED event is only for Glenn Medical Center, Modoc Medical Center, and Trinity Hospital. The red event has gone and ended. We just have the purple HAVBED drill. And again, at Glenn Medical Center, Modoc Medical Center, and then you can't see it on the screen, but Trinity Hospital is also queried. So, a single HAVBED drill, the icon is shown by the facilities of, again, Glenn, Modoc, and Trinity Hospitals. Here's this in greater detail. This shows the Glenn. They haven't updated yet because this was a drill. Modoc Medical Center, again, haven't updated yet. And then Trinity Hospital hasn't updated yet in this particular view. This was created by me on the 18th of May, 2014 at 9:27 in the morning. And so this is what it would look like, and this is how it totals everything up. So here's a Plumas County Hospital bed poll, and this shows that Eastern Plumas Healthcare has 4 ED beds, 1 OBGYN, 3 med-surg, 3 peds, no ICU, 2 ventilators that they could use temporarily, no step-downs. Seneca Hospital showed an update of 4 ED beds, no OBGYN, 5 med-surg, 0 peds, 0 ICU, 3 vents they potentially could use, and 6 step-down. In the comment section, currently active moderate physician and ancillary staff in-house. And here the staff summary is everything summarized. In these 3 hospitals, there are 8 ED beds, no ICU beds, 11 med-surg beds, 1 OBGYN, 3 peds, 6 step-downs, and a total of 5 vents if they needed it. So this goes through those 3 slides. Again, only HAVBED drill for the 3 hospitals of Glenn, Modoc, and Trinity. Each of these categories are shown, and then it shows a HAVBED drill for Plumas. This is a customizable event for Plumas. They customized it. Updating resources in general. On any view, you locate the facility's name, ensure that the quote key icon is next to the facility, whether it's the bed or the flaming envelope. If the key icon is present, then you have the appropriate permissions to update the facility status. If not, you need to contact the administrator of the system. You need to do this ASAP before an event to make sure. So let's go back. I think I may have misspoke. Let's show the keys. Right here is the key, the set of keys right next to the medical center. So here Modoc has got the right permissions and Trinity has the right permissions. So click on the current status, a new window will open, and you click on the appropriate status or the data box for the appropriate specific information. Always remember to save the data entered. Real bummer if you click out and you haven't saved it. So after an event has been initiated, your facility may receive a request. That would be the flaming envelope or the bed. By clicking on these icons, you'll be taken to the query response page. You may also need to navigate to the response screen just by clicking on the colored alert bar that is located below the sub-navigation bar. Once you're on the query response screen, you'll notice that the items in which you are to supply information have red initial values. This allows you to see what has already been modified and what is still untouched. So to change a value for an item, find the row in which your hospital facility is listed. If you're a trauma center, be sure to find the row in which you are listed. Follow the row over to the first item to be changed. Click on the red text or number. Another window will open. Change the value to the correct one and type in any associated comments for that value. Click on the saved value. Continue on through all the items needed for your hospital. If at any time a value needs to be updated, just repeat the above steps to change them to the new correct number or setting. Remember, this is only a snapshot of capability. This is constantly real-time and changes. So you want to make sure that you're updating regularly during a real event. Again, please ensure that you take full advantage of these free sessions for intern medics. Thank you for your time. Thank you for your attention. Have a great day.